I'm Dr. Russell Faust, Oakland County's Health Division Medical Director. Today I'm joined by Dr. Operti-Considine from Kidz1st Pediatrics in Rochester Hills to answer a lot of questions about the new pediatric COVID-19 vaccine. But before we discuss the pediatric vaccine, just want to review the COVID-19 update. Now, the state's COVID-19 vaccine dashboard reports that 827,000 Oakland County residents 12 years and over have been vaccinated with at least their first dose. We are currently at about 75% vaccination coverage who have received at least their first dose. 12,395 children 5 to 11 years have received their first dose of the vaccine. Unfortunately, despite that great vaccination level, we're at a level of high transmission based on the CDC's level of community transmission tracker. The 7-day case average in Oakland County as of yesterday was 791 new COVID-19 cases per day. This is a steep increase compared to the 7-day case average a month ago, which was 338. On November 2nd, Pfizer's COVID-19 pediatric vaccine received emergency use EUA authorization for children 5 to 11 years of age from the U.S. Food and Drug Administration and was recommended by the U.S. Centers for Disease Control and Prevention's Advisory Committee on Immunization Practices. Oh my gracious, ACIP. This great news brings us another step closer to ending this pandemic. And I just wanted to cover some of the common questions about the new pediatric vaccine with Dr. Operti-Considine, who is a pediatric specialist in our community. So Dr. Operti-Considine, thank you so much for joining us. We really appreciate your insights and expertise and experience.
Well, thank you for inviting me to talk about something that is dear to my heart. I am excited as you are about this authorization, and last weekend our clinic gave 300 of those doses, and we were very happy. Parents were thrilled, and kids not so much, but it's okay. So the difference between the adult and the pediatric COVID vaccine is mainly two. One is, like everything, kids do things much better than adults. They're much faster learners, so they were able to make the dose much smaller. So adults get a 30 microgram per dose, and kids were able to do 10 micrograms. So what that means is that they tested 10 micrograms, 20 and 30 in kids, and they saw that they were able to create the same immunity with 10, same as adults and older teenagers, but with a lot less side effects. The other difference is the buffer. The buffer is something they put in the vaccines to maintain that acidity. And why that was important is that it allowed the temperature where this vaccine is stored to be much lower. The goal of that is that the idea is that pediatricians should be able to provide this to kids. The adult one has to be stored in ultra freezer. So when we were able to give the adult vaccines to older teens, there was a lot of strategizing with health department because we did not have those capabilities of storage. So those two things allowed also to make the vaccine to be given with a smaller needle, which that kids always like.
Absolutely, yeah. So it's in practical terms easier to dispense and manage by a pediatric office.
Much easier.
Yeah,
so much easier. So it allows us to then, as time goes by, to provide it as one of the regular vaccines we give to kids.
Wonderful. So you're fairly experienced with it now.
Well, I guess so, if 300 does it.
So I guess the question parents will have is about adverse side effects. You know, there are a lot of myths circulating on social media, for example, and I can certainly address some of those, but what can you tell the parents about what to expect? You know, just kind of generally what to expect when they bring their child for the COVID-19 vaccine.
The side effects that we saw really the day of when we gave it, we had no issues. I was monitoring the parking lot in a very nice cold day, but really nothing happened. And we got some calls saying, you know, the arm was sore and if they could take Motrin or Tylenol, and that really was the extent. And the reports, I mean, the test that they did that was 3,000 kids. Originally, they saw literally that, sore arms, maybe body aches for the first 48 hours. I think a lot of people have a concern that why only 3,000 in the test. And the reason for that is when you do a test, you have to have kids that have the vaccine and kids that don't have the vaccine. So during those 3,000 kids, 18 of those who did not get the vaccine got sick. So the question was, you know, how many kids are you going to allow to get sick? And then you say, okay, this is enough. And they saw the immunity and the side effects correlated with the adults, so they considered that that was a scientific valid number.
Yeah, absolutely. And historically, the FDA will require just about that, 3,000 experiment cases. I hate to use that term, but 3,000 clinical trial cases for a vaccine to be considered, you know, all the way through the clinical trials. That, you know, a dozen for phase 1, maybe 100 for phase 2, and then up to 3,000 for phase 3 clinical trials, and they've certainly met that that normal criterion. And I should emphasize for the parents that are concerned about these vaccines not being well enough monitored, that the COVID-19 vaccines are the most heavily scrutinized vaccines in the history of all vaccines. You know, obviously,
Agreed.
These are potentially controversial, and frankly, they're all under a microscope. So I do want to reassure parents on that. Do you have any experience or anything to say, an opinion perhaps, on the myocarditis scare from the vaccine, for the older teens?
Yes, so they've seen in the ages between 16 and 25, predominantly males, probably 75%, cases of what they're seeing called as myocarditis, which is really a very, very mild form. Myocarditis by a wild virus, when somebody gets it, it's a very severe disease. This is not what they're seeing in the kids after the vaccines. They have very mild symptoms. They most of the time are admitted in the hospital because we want to watch them as a hawk, and they really get IV fluids, ibuprofen, symptomatic care, and then they go home. So it's a very mild, if so. Now, what they also saw that in that age, which is the highest risk, is around 1 per 50,000. Now, in the younger kids, the risk is much when the cases were drastically decreased, as with myocarditis. So what we think is that the risk, even now between 5 and 11, is going to be that much lower. Not sure while it's males in that age, but most of the time it's females, so this time is.
We should point out that the risk of myocarditis from a COVID-19 infection is at least 10 times greater than the risk from the vaccine, and is a much more severe disease.
Much severe disease with much long-term complications.
Yes. And so you're much better off with the vaccine than risking COVID-19 infection. I should really want to stress that. I'm going to cheat and look at my sheet.
I think you want to ask me about the mRNA vaccines and how they were made, and
yeah, we've talked a lot about that.
Well, but let me add something to that, though.
Do that.
So people have a lot of concern about the mRNA vaccine. mRNA vaccines started to be investigated in 1961, even before I was born. And they started doing trials in 2001. So it's not a new vaccine. What has happened and why this went so fast, which makes people very concerned, is because we had three things that we needed to make this move along. One was the incredible amount of money behind it, because everybody wanted to get this solved. The other one was the amount of people that were willing to participate in trials. And the third, which is the hardest one to control, is the amount of exposure. We were in a pandemic, which means that these people were readily exposed to the virus and they could see how they would react. And that is what generally takes a long time. So with all this, we've been giving vaccines for 200 years. And what has changed is only the way that the body is presented with that protein, that part of the virus or the bacteria that the body needs to learn to protect itself. What has not changed is the body keeps on being smarter than all of us put together. So what hasn't changed is what the body does when that protein gets to our body. It still goes to the lymph node close to where we got it, and the body creates the protection. So in those 200 years of vaccines, there have been no vaccine that has had a long-term effect. The effects have been seen at the most 6 to 8 weeks later. So I believe that there is no reason to think that the part that is not under our control, which is how the body responds to the vaccine, there's no reason why to think that this should be any different. The only thing that changed, we have provided vaccines by giving part of the virus, but giving part of the wall, but part of the protein. We have viruses that take some of the good viruses, that take some of the bad viruses. But the end result is that the body is the one who decides how to respond to it, and that has not changed. That has been always the same. You create immunity, you create your soldiers, and you send them out to fight.
And the other thing that helps speed along development of this vaccine, the mRNA vaccine, is that it had actually been in clinical trials for Ebola the year prior. And so having that methodology already developed, they were able to just take the message and slot in the message for the spike protein and get into clinical trials very
We were
rapidly.
ready.
Yeah, they were ready. As you say, they've been working on it for decades.
Yeah.
I should say thank you for joining us today. So we don't prolong this. We really appreciate your insights. I'm sure parents out there appreciate being reassured. And I would like to say that for those that are interested in getting the vaccine, we are conducting local vaccine clinics for people 5 years and older. Visit our website, oaklandcountyvaccine.com, to find a clinic location that works best for you and your family. Those who do not have access to the internet may call our nurse on call at 800-848-5533, Monday through Friday, 8:30 a.m. to 5 p.m. for more information. Thanks so much for joining us this week. As always, continue good hand hygiene, wash your hands frequently, wear a mask when you're in crowds, especially when you're indoors, and get vaccinated. Thanks.
Thank you.